Yeah, please start.
Ma'am, can you make me the co-host? I want to share the screen.
Yeah, sure. So who is presenting?
Aryan Mittal, ma'am.
Aryan Mittal and Shubham Kumar, right?
Yes, miss. Yes, miss.
Okay,
All right, miss.
please.
Honorable Speaker, respected Finance Minister, and all the parliamentarians, a very hearty evening to all of you present here. Today, we, the Ministers of Health and Ayush, and are here to present our demand for the budget of health and family welfare and Ayush. So, here we begin.
Tobacco associated problems in India. Tobacco has been a major problem of India in the past few decades. It causes diseases like cancer, heart strokes, lung diseases, diabetes, etc., which on further scale cause 3,500 deaths per day on an average in India. It is also one of the most preventable diseases. The production of tobacco in the past decades has also been constant at a rate of 800 million kg, which is very high.
The policy which we would like to implement is Totomi, that is, tobacco to millet. Retail taxes on tobacco products should be increased to 75% as suggested by the World Health Organization. This would surely lead to the downfall of the local tobacco market, which would be met by increasing the exports of tobacco. Gradually, the land would be shifted from tobacco to the production of millets, which are cheaper and healthier.
R&D on health. As we know, the SARS-CoV-1 outbreak took place in the years 2002 to 2004. Not much R&D was done on this virus, which led to the SARS-CoV-1 CoV-2 breakout or outbreak as the COVID-19 pandemic. Hence, a considerable amount must be spent on R&D in the healthcare.
National Rural Health Mission. In this financial year, 2023-24, government has done a direct allocation of rupees 0 crore. That means no budget to be allocated for NRHM. But we all know it's a very important sector of health, as health infrastructure is required on a primarily basis in rural areas.
So this is the budget transfer system or BTS for the health sector, wherein an amount of 2 crore 2000 crore rupees from the establishment expenditure on new aims should be taken out and saved as the saved budget or the SP, which is rupees 3000 crores.
Revenue for health. So, tobacco exports and revenue would amount up to rupees 32,000 crores. The budget saved from the establishment of expenditure on new aims is around rupees 2,000 crores, and hence the total revenue we can save is rupees 35,000 crores.
Budget transfer system phase 2. Till now, through all ways, we have saved a total of 35,000 crore rupees. So how we want to devote that budget in the following sectors. National Rural Health Mission, rupees 12,500 crores. Research and Development, rupees 7,500 crores. Tobacco to Millets, rupees 7,500 crores. And Ayush, rupees 7,500 crores.
In the Ministry of Ayush, PLI or production linked incentive should be provided exclusively for Ayurvedic products to increase their exports and usage, generating an approx revenue of about rupees 1000 crores. In some targeted areas, Ayurvedic centers should be opened near ration shops to promote Ayurvedic treatment. These centers would be funded at an amount of rupees 5000 crores.
So these are the demands we would like to present in front of the finance minister. demands are being shown in the image. And as we can see, there will be a considerable decrease in the expenditure in the health sector with increased efficiency. This is the end of our demand presentation. Thank you to all the parliamentarians for hearing to us. Thank you. Jai Hind, Jai Bharat.
I would like to call now Inia and team from opposition. If you have any queries, if you have any questions, if you want to oppose anything, please go ahead.
Could you give us 1 minute, ma'am? So you stated that the main dependence is towards Totomi, right? So 7,500 crores would be gained through Totomi. But I have a question regarding this, ministry. So suppose we are increasing the taxes for tobacco. How would this affect low income families? Because when taxes are increased, this might result in regressiveness, right?
Okay, so first of all, we would like to answer in this way that the data which you give, I think you have not understood. It will approximately lead to revenue of 30,000 crores, okay, 30 or 32,000 crores, okay. And the next question which you asked was that it will affect the poor families. So if you see that poor families, although they are buying tobacco, but if they buy tobacco, then their chances of cancer and chances of death also increase. But if we will increase the taxes, it will go beyond their affordability. And if tobacco products will go beyond their affordability, then they will not buy, leading to less number of deaths. And as we see the data, it was 3,500 deaths per day because of tobacco, but it will be decreased substantially.
I hope that's clear. Do you have any questions more?
No, that was clear.
Anybody else has any question for them? Any suggestions you want to make to them? No? Okay. Thank you, Shubham and team. Thank you, Inia and team. Right?